Of notes before we get started. The first thing is that the webinar is being recorded, so all my bad jokes are going to be captured into eternity. You'll receive a follow-up email with a link to the recording after the webinar. If you have any questions about the webinar, please contact us at the following email address, which is socialmedia, all one word, at bbd.ca. Second, there will be a number of interactive poll questions. I think this might be our first webinar where we're trying this out, and Tim wanted to see if we had this functionality, which we do. So we're going to be soliciting your feedback throughout the webinar. They're not a test, and there's no right or wrong answers, but they will help guide us through our discussion and the content of the webinar as we move forward. And finally, we'll be running some question and answer session after the main presentation, so please encourage you to stick around. There's no such thing as a silly question, so ask away, even though my wife frequently tells me there are silly questions coming out of my mouth. If you do have a question, please type it into the GoToWebinar interface. You'll see that, I think, on the right-hand side, if it's like my screen, and we'll capture those as we go along, and we'll address them at the end of the webinar. All right, so without further ado, I'm going to introduce our speaker. Tim Clarke is the founder and president of TC Health Consulting, Inc., and he brings more than 20 years of experience in international HR consulting to the table. Tim has worked with firms like Aon and Hewitt, I should say, where he held various leadership roles, including Canadian Health Consulting Practice Leader and Chief Innovation Officer. I love those titles when people get Chief Innovation Officer. It means they get to do everything and nothing at the same time. Tim founded TC Health Consulting. No problem. Health Consulting with a vision to work with all industry stakeholders to bring the next generation of innovative health, benefits, and insurance solutions to Canadian employers, and we're excited to have him with us today. So without further ado, welcome, Tim.
Great, thanks, Mike. And Mike, I'm not sure that after the comment about it snowing in Ottawa, that the NHL playoffs were really quite the way to make it up to the folks in Ottawa. But you know, we'll pass on that and move on to the presentation. Thanks very much for having me. As Mike alluded to, have spent a fair bit of time over the last couple of years on my own, and for a number of years before that, looking at sort of the next generation of solutions coming to Canadian benefit plans, hence the topic today, specifically looking at telemedicine. It's a topic that has been growing rapidly over the last couple of years. I want to hope to give everybody a bit of perspective on kind of where it's coming from, both international context as well as some Canadian context, and then talk through what you need to know here for your Canadian clients. So just very quickly, you know, what is telemedicine? Why is this an issue? We'll kind of go relatively quickly through a number of points there. Again, want to look at a bit of the international landscape as well as the Canadian landscape. Where I'm going to spend most of the time is talking about what's going on here in Canada right now in terms of the current landscape, but also how to have the conversation about telemedicine with Canadian HR, Canadian benefits folks, what they need to know, and some of the questions you need to ask them in order for them to make good decisions about where they're going. At the end, I'm going to expand a little bit beyond the topic of telemedicine and get a little bit further afield into what some of the things might be coming down the pipe in a broader definition of virtual care. Again, having spent many years in the seat of the advisor looking to speak to employers as clients about these topics, I know that there's a lot of these topics that can be great, interesting conversations, but at the end of the day, this is all about getting tactical and practical, whether a client needs to be implementing or should be implementing a telemedicine solution. The folks in the line as advisors need to be able to have that conversation with them to make a good decision. So one of the things that I really did not expect to be doing when I started my own consulting business a couple of years ago was paying to be able to use cartoons in presentations, but lo and behold, here we are. it wasn't very long ago that the idea of telemedicine within employer benefit plans in Canada was not even a conversation. Go back 2-3 years, there were a couple of startups that we were vaguely becoming aware of, but it really wasn't a regular topic of conversation. I guess my goal for today is to make sure that the telemedicine circa 2019 is a little bit more fulsome discussion than the one on the slide in front of you. As mentioned by Mike, we are going to try and do a number of polls as we go through the presentation today. The first one here is simply a test to make sure that we all are familiar and can use the technology. So at least on my screen, it's the drop-down bar on the right-hand side of the screen right now. You should see now open in that drop-down bar. Polling question. So fairly straightforward. Where are you sitting right now to listen to this presentation? Given that it is a visual webcast, I'm really hoping we don't see a lot of number 4. I don't want to be the cause of too many accidents out there today. And can see a good number of results coming through. We do have somebody, at least one person's admitted to calling in from a coffee shop. We'll try not to make too much noise to the patrons around you. Looks like we've got a fairly good number of responses there. So assuming that means everybody's managed to get the technology to work. So I'm going to close that poll off, and we're going to move into the presentation. So just a quick bit of background. Some of this may sound obvious and sort of easy to explain, but the question of, what is telemedicine? And we'll get into in a minute kind of why and why are we having this conversation. But in broad terms, the term tele, to be quite honest, in my mind is a bit of a misnomer. It sort of implies telephone. Really what we're looking at here is anything that involves the delivery of healthcare services that doesn't involve two people meeting face to face. And when you think of the way most healthcare is delivered in Canada today, whether you're talking about the public healthcare system or an employer benefits plan, really almost everything involves two people meeting face to face. So the idea of telemedicine is a bit of an anomaly and a bit of a stretch. Shockingly, compared to what else has become, digital and online in our lives, healthcare and insurance are two of the last frontiers for the digital revolution. So for the most part, there are a number of different definitions of telemedicine, and it's one of the joys of having a field that's growing so rapidly. The number of terms I've seen people use between digital health, m-health, virtual care, mobile health, etc., that all capture different elements of this digital aspect of healthcare. What we're going to try and do today is keep focused on the idea of remote interactive care. So the video visit with a physician or a nurse, in some cases that can actually be telephone, but we're going to stick to the video piece of that, which is where a good number of these Canadian startups are coming up. And really, from the perspective of where telemedicine is used, and I'm going to talk first of all in a global context, and we'll get down into Canada. Obviously, not everything to do with healthcare can be handled via telemedicine. Certain types of interactions do require people to be face to face for various reasons. Telemedicine is also not geared towards emergency care. Again, another reason why you'd need to be face to face, whether that's with an emergency room or a health practitioner of some sort. So the focus tends to be on one of a couple of things. It can be acute, non-urgent care, which is really where most of the Canadian solutions are right now. But increasingly, especially elsewhere in the world, we're seeing telemedicine be extended into ongoing or chronic care situations, really enabling someone to be able to get care between visits to a physician or a healthcare practitioner, as well as replace some of those visits. So in terms of some of the why, the ones that we hear kind of come up, and there's a number of reasons why organizations and health systems are looking at moving into the telemedicine and the virtual age. Obviously, access to care, whether that's remote access, whether that's specialists that don't exist in your area. If there's a specific type of practitioner that could be hard to reach or hard to access, both the ability to and the speed to access those resources is improved substantially by not having to actually get two people together face to face. It also enables you to actually stretch your healthcare resources perhaps a little bit differently and utilize them differently than in the past. Something as simple as a physician's office or any kind of practitioner where people don't show up for their face-to-face visits is lost time on the system. To be able to fill in some of those gaps, whether they be between visits or evenings and weekends, having the practitioners being able to practice on their own time actually enables the system to add some additional resources. Obviously, from a technology perspective, everybody's looking to use digital technology in one way or another. But this next one is one of the ones that definitively is a driver in some places around the world, which is cost reductions. If it costs $100 to visit a physician in person and $50 to do a virtual visit, why wouldn't a healthcare system look to use technology to reduce the cost of the system overall? And there's lots of reasons why the cost of a virtual visit can be cheaper. Just simply not having to have a bricks and mortars physical location is a big one of them. And the last piece here, and this again is less common in the Canadian context, at least today, but it's a huge piece of why we see telemedicine and virtual care globally, which is this idea of being able to continuously, whether it's monitor, educate, or even provide treatment between face-to-face visits. So don't think of telemedicine as a replacement for in-person care. Think of it as a complement for in-person care. You can actually look at some models that are a combination of in-person and virtual that actually work extremely well in different situations. So from a global perspective, I'll talk there first, and then point out just kind of a nuance that makes Canada a little different, and then get into some of the Canadian context right after. Really, the three pieces that are some of the biggest drivers, convenience, remote access, and we see this all over the world, where the desire for people that may not have access, especially to specialists and certain types of emergency care, to get access quickly is a big rationale for telemedicine. The last, of course, for everybody is cost reductions. And just to give a little bit of context, obviously, if a virtual visit is cheaper than an in-person visit, it makes a lot of sense to switch care from an expensive methodology to a less expensive methodology where the care and the quality of care is the same. In the United States example, where an employer is paying for the entirety of the healthcare dollar, whether that's inpatient or outpatient. In Europe, where generally the public healthcare system is paying for both inpatient and outpatient visits, it makes sense if the same person is paying for both of those visits, that one being less expensive than the other makes sense. In Canada, we have this weird anomaly, and this happens a lot of times with our healthcare system. Specifically, it's happening right now with telemedicine, which is when you move a doctor's visit from in-person to virtual, so telemedicine, it moves from being paid for under the public system to being paid for by, and I say here, someone else, whether that's an employer or an individual. So you've got this weird situation of switching the cost from one payer to another when you switch the care from one mode to another. Just a couple of statistics in terms of kind of global use, and have pulled all of these out of reports that I've seen just even in the last couple of weeks. And some of the numbers, now recognizing that in some places you're starting from a fairly low base, the size of some of these numbers is fairly astounding. The idea of the global telehealth market growing by close to 30% annually over the next 5 years. Some of these U.S. growth rates. And the main reason I put these up here is it's not just rural, it's urban as well. That percentage growth rate, obviously, fairly astronomical over that 5-year period. But even in the most recent years where I had stats available, 53% jump in telehealth or telemedicine use in the United States over the last year. So some fairly substantial rates of increase around the world, essentially illustrating this is not a Canadian phenomenon. We're kind of dealing with it in a very Canadian fashion, but this is a global phenomenon going on. Okay, I'm going to open up our next poll here. So before, as I move from the global context and then into a little bit of information about Canada, just want to gauge the knowledge level of the audience here. And again, as Mike says, you're not being tested on this. BBD claims not to be able to know who is putting in what answer. So feel free to speak clearly or to speak freely. But just how familiar are you with the telemedicine options that exist within Canada today? As I said, there's a number of them out there, but it is a fairly new element on the radar screen of employers, of insurance companies, and advisors. So just curious to see what kind of level of awareness. And answers coming back basically say reasonably or somewhat aware. We've got a few people in the audience who feel like they're very familiar. Hopefully, I've got one or two little tidbits for those folks in the audience. For the 17% of people who are responding, tele what? Hopefully, we can give you a little bit more background so that you'll be able to speak intelligently to your clients momentarily.
Tim, just jumping in for a quick sec. If you click the share button within the poll, I think only you can see that, then visually the attendees can actually see it dynamically, I think, too.
Okay, so once I close, I can hit share.
There you go. Thanks.
Does that now show up for others?
Yeah.
Great. Thank you, Mike. Yeah, I have to close the poll first before I can share, by the looks of it. So appreciate that little tidbit there. So we'll move forward and talk about kind of in a Canadian context, a bit of, yes, this is a global phenomenon, but one of the comments and questions you certainly get in Canada is, why are we talking about this? I thought we had a public healthcare system. Why are employers needing to get involved in this? Isn't this simply something that should be our healthcare system moving into the modern age? Now, hopefully, not too much sarcasm came out in that comment about our healthcare system moving into the modern age. But at least at this point in time, virtual care and telemedicine is not, I say, generally covered across Canada. There are some instances, and this is changing regularly. The three sort of specific examples, in many provinces, there is an ability for remote communities to do telemedicine, whether it's with specialists or whether it's even with general practitioners, depending on how remote the community and how lacking the local care is. There is emergency phone services available in many provinces, the 1-800 nurse lines of various sorts. I include them here just simply because telemedicine, you should list the phone services as well. And the province of British Columbia is actually the lone province in Canada that covers virtually all telemedicine visits under the public healthcare system. My understanding is there's not an enormous take-up on that because they are right now still reimbursing doctors less for the virtual visit than the in-person visit. But that's a relatively new development to pay for that broadly. So we'll see how that evolves over time. But even with those couple of examples, what it essentially means is we've got a gap right now in our public healthcare system. And according to the Canada Health Act, if something's not covered by the public healthcare system, it means that private insurance is allowed to step in and get involved. Hence, what's led us to the conversation today. We've had a number of providers step up and try and fill this gap. Now, before I get off of the public side specifically, I should say that the Canadian Medical Association has just recently announced a task force. I worry when I see things about associations and governments and task forces and start to have pharmacare come to mind. But the CMA announced a task force just last month. And here are some of the quotes out of that release, essentially recognizing that it's needed, members want it, and lo and behold, 20 years into the 21st century, we're looking at the CMA talking about bringing our healthcare system into the 21st century. Now, is this the beginning of a process that'll see more broad telemedicine and virtual care across the country? It's possible. It's even quite likely if you look far enough in the future. The challenge is, how far in the future do you need to look? This is a task force that is going to be providing recommendations sometime in 2020. So not a plan of action, not implementation, but recommendations. As many of us would know from the number of times over the years and decades that we've seen pharmacare come up in conversation, just because there's a task force doesn't mean we're going to see substantial change in the public health system very quickly. Nice to know that this is going on out there. Yes, at some point in the future, I fully believe that telemedicine and virtual care will move in the public healthcare system to some degree at some point in time. It's just a matter of we need to deal with the gap in the short term. So, given that the global trend is an enormous leap in telemedicine, the Canadian public system is beginning to think about tiptoeing in that direction. What we're left with is the current landscape now for telemedicine for employers in Canada. And just as a couple of points here, the way most of these systems work, it is a ability to connect generally with a physician or nurse by video call. As I mentioned before, most provinces, with the exception of British Columbia, don't cover this. In a lot of cases, what the view is it's almost a replacement for a walk-in clinic. It's that acute, non-emergency, I'd like an opinion or some advice without having to wait in line for 4 hours. It's 3 o'clock in the morning and my daughter has a fever. I want to know whether I should be sending her to daycare tomorrow. There's a lot of occasions where being able to get good information and good care quickly at off hours can be very convenient for individuals, and that's the convenience has really driven a lot of the demand. Just a couple of stats here, and this is from the CMA survey that probably actually led them to starting the task force that they're now working on. Most Canadians would love to be able to access their healthcare system more digitally or virtually. 69% of Canadians would use virtual care if their physician was available. 75% want to see more technology in the healthcare system. Those really aren't overly surprising numbers. I saw, and this is not statistically accurate, but someone who had done a health and technology researcher that did a poll over Twitter in the last couple of days, and asking people what their preferred method of visiting a physician for a non-urgent issue would be. And it was something in the area of 10% that said face-to-face in person. Everyone else was saying some combination of video, text, chat, phone call, etc. So we're seeing this as a phenomenon that will just continue as employers. This is now looking at how do employers help their members to try and navigate this landscape while they're waiting for the government to really look at and step in. So I've alluded to a couple of times that there are more than a few providers out there in the Canadian context right now. I know there was everybody indicated that there was some level of familiarity with the telemedicine providers that are out there right now. Just curious again to get your take on how many are you aware of? And I know as I speak to people across the industry, hearing more and more people who are familiar with the concept, maybe know the names of a company or two, but I the other day was mentioning in a conversation how many of them I've been keeping track of, and everybody was a little bit surprised just to hear how many there were. So Mike, let's see if I do this properly. I can close and share the results. So most are familiar with one or two. Fair number of people familiar with kind of upwards of three to 10. Right now, I got 11 names on my list that I keep of providers, and quite honestly, that still changes on I won't say weekly, but certainly on a monthly basis. The bottom line is, with more than just a couple of providers that are out there, one of the challenges is not just should a client be looking at telemedicine, but how do I make a decision about which one of the telemedicine providers to actually speak to or recommend to my clients. So in the context of trying to help people navigate through all of these choices and how to choose, I've got here's a list of, I guess there's 10 of them on here that are fairly prominent names, depending on the geography, depending on the business model, depending on the insurance carrier you might be talking to. Some of these names may be familiar to you, both in the context of existing services, so people like Medcan and Medisys, but there's also others on here that I think others will have heard of from a telemedicine perspective. One of the interesting aspects is we're starting to see, and over the last probably year or so, I've seen a lot of partnerships between, and I'll say insurers first, but we're seeing other partnerships within the industry as well. So, as an example, Sun Life has partnerships with 3 different telemedicine companies: Akira, EQ Care, and Maple. Great West Life, the now rebranded Canada Life, has a partnership with Dialogue. Desjardins a couple of months ago announced that they are working in partnership with Medisys, who is now owned by TELUS Health. There's also some interesting combinations of partners kind of outside of the core insurance industry. Best Doctors was actually purchased by Teladoc. My understanding is they're actually going to be rebranding Best Doctors to be Teladoc Health. Teladoc is a major player in the U.S. telemedicine market. TELUS Health has a partnership with Medisys, as I mentioned a second ago, but also with Babylon, who is a major player in telemedicine in the UK. So you start to see that there's not only partnerships forming here, but there's also a substantial amount of international flavor starting to enter the Canadian telemedicine market. That's not to say that every insurance carrier has a partner. Just as a couple of examples, Manulife and Green Shield, at least as of when this call started, I don't want to make any assumptions about when the call is over, but don't have any formal partnerships announced to date. From the perspective of an advisor, how important is that kind of formal partnership? It's important, but it's not necessary. So even the carriers that do have partners, that doesn't mean that a client who is working with Desjardins has to use Medisys. It doesn't mean a client with Sun Life has to use one of their providers. Sure, it's a good starting point for conversation, but it doesn't necessarily need to be the only place you go and look if you have a client looking at telemedicine solutions and looking at who the right partner might be for them. So let me spend a couple of minutes talking about helping employers making these decisions. And I again won't comment on exactly how statistically accurate the survey might be, but I thought this was an interesting stat that was done on one of the weekly surveys that Benefits Canada does on their website. Now, granted, this is probably a more knowledgeable audience that they would be speaking to, or they would be getting feedback from, than the general public. But if the answer is anywhere close to 88%, this indicates that employers have an interest, certainly in knowing more, if not in actually implementing a solution. So I made the comment at the beginning that you only have to go back a couple of years to a point where there really wasn't a lot of conversation going on with employers, and advisors really weren't able to have a great conversation with their clients about the telemedicine options that are out there. Hopefully this is not the way you're having the conversation today. Certainly, hopefully it's not the one that you're having at the end of the call today. So in terms of figuring out who the right partner is, or whether an organization should be seriously looking at telemedicine, a handful of questions to answer, and none of these are necessarily a definitive yes or no. They're not necessarily a definitive answer to who the provider should be, but good conversation starting questions to ask the organization. And the first basic one is, why are we having this conversation? What is it the employer is trying to achieve by looking at a telemedicine solution? Is it about productivity? Is it about being able to allow that the parent to be able to come to work because they don't have to worry about taking their kids to the doctor to find out that what their ear infection is? Is it about cost savings? Is it about being able to reduce, be it absenteeism costs or other healthcare costs, by being able to get quick access to service? Is there a business need? Do you have employees working in extreme remote communities where this kind of access is actually a core part of their healthcare? From there, getting into some of the questions to ask that'll help you understand what providers you might be looking for. Geography. Not every provider right now is national. Are you looking at somebody who can actually provide telemedicine services to your employees when they're traveling outside the country? The different healthcare providers, especially from a triage perspective. There are some platforms that are focused on physician only, others that will use a combination of AI or nurses to help people get care. Is that important to you? Do you have a preference as to what kind of service or what kind of provider you want to have? Obviously, the question of what hours. Do you want this to be a 24/7 service, or is something slightly less than that acceptable? The acute versus chronic question, as I mentioned, right now we're not seeing a lot of chronic care and chronic disease management offered through telemedicine platforms. That certainly is a potential direction. It's a big component of the US and global development of telemedicine. We may see that coming in Canada sometime soon as well, so good to know what an organization might be looking for there. One of the key questions: who is the employer intending is going to pay for this? Are they viewing this as a company paid service? Are they viewing this as something where they can give employees access to a service that the employee will pay for? Do they want some sort of combination or shared model? A key question in terms of looking at which of the providers on the market might be the right ones for you. Kind of tied into that, who's paying, is how should the pricing model work? Even if it's an employer paid model, should it be done on a per employee per month basis? Should it be per use, or should it even be per case and connected into a disability program? A lot of different ways to set it up, often flexibility within the same providers. But it's important for an organization to understand, how do they want to set it up? Who do they want to access? Who should be paying for it, and through what mechanism, in order to effectively have a discussion about telemedicine before you even get into the discussion about which provider to work with. Last point, right now there's a number of the providers that will be able to do prescriptions for an individual based on the video call that they have with them. Can often arrange for that prescription to be available at a local pharmacy. It's one of the growing questions, though, of not every health question can be answered in that initial conversation with a general practitioner. It may be something that needs connection to a specialist. It may be something that needs, you may need another type of care, whether that's from a paramedical practitioner, from a mental health perspective. How does the referral system work at the provider that you're talking to? Now, I know I've seen variations of, and I expect that a number of people on the call have seen variations on this innovation distribution curve in the past. Really looking at, you've got innovators at one end where every shiny new thing is a great idea, and you've got some people on the other end of the spectrum that maybe aren't so excited about new technology. Right now, depending on who you talk to, and even Mike and I had this debate the other day, certainly telemedicine in Canada from an employer perspective has not crossed that chasm yet. Whether it's in the shiny new thing with the innovators or whether it's kind of gotten into the early adopters phase is debatable, but it certainly hasn't jumped the chasm, which means that right now we're looking at, where is this going to go over the next few years? But regardless of the overall prevalence, this really is, again, something that's an important enough topic. If 88% of respondents to that Benefits Canada survey think it should be something that's in a benefits plan, advisors need to be able to talk intelligently to clients about how it works. So, bottom line, this is a conversation that you have to have. I mentioned a few times we go through, the role isn't necessarily to be a complete expert in being able to have this conversation with your clients. You don't need to know everything there is to know about the 11 plus providers that are out there, but it's a conversation that you should be prepared to have. Most important part of that, unpacking the issue. What's the problem they're looking to solve, and what kind of solution are they looking for? Once you get beyond that, then it's an ability to assess the candidate companies, the different telemedicine providers that are out there, whether it's their company structure, are they partnered with an insurance company that you're working with now, what kind of service, when do they provide it, how do they provide it, how does their price and pricing model work? These are really assessment questions that would sound very similar to helping an employer select an insurance company, an EAP, a wellness provider. A telemedicine provider is no different. Unpacking the question and knowing what they're looking for makes it much easier to be able to assess whether or who the right telemedicine provider is that fits best for them. So I'm going to go back to the polls here for a minute or two. So I got actually two separate questions to ask. And I'm going to have to go to the next question. There we go. How do you speak about telemedicine to your clients right now? And again, lots of variety in terms of the conversations that are being had, depending on the kind of organization, the kind of clients you're working with. Different. Sometimes it's a big topic of conversation. Other times it's only a small element right now. Definitely seeing a predominance in the answers of organizations are not necessarily recommending or looking for solutions right now. Educating or the topic never coming up. I'm going to share that information with folks here. So 49% says it never comes up in conversation. A third are educating clients, but that's all they need. 15% as a company paid benefit, 3 as an employee paid benefit. So, even to see 15% plus 3, so 18% recommending in some way, shape, or form telemedicine to clients does say that we've kind of getting close to that chasm. Haven't quite crossed it yet, but it's definitely a topic for conversation. So talking about the recommendations to clients, just a quick prevalence. Even if you're recommending to clients, doesn't mean that you've got everybody implementing it. Could only be a small fraction of the employers that you're talking to. Again, trying to get some sense of both to share with you during the presentation here, and I think to get an idea of exactly where we're at from the perspective of seeing advisors and employers talking about telemedicine in Canada. So I'm going to close that fairly quickly and just share it with you there. Again, 13% of people on the line are saying over 10% of their clients have some kind of telemedicine offer. That's probably a bigger number than I would have thought to see. The fact that it's only 23%, they're saying less than 1%, means that the majority of people on the call are seeing some clients implementing telemedicine it's obviously hit the stage of need to be able to talk to, need to know about it to some degree. It's just a matter to what degree. Okay, so I'm going to quickly go through, and I want to make sure to leave some time for questions. Telemedicine is the main topic of the conversation today, but I want to make sure that everybody's got on their radar kind of where this could be going or will be going next. And in part, that's because the idea of telemedicine is it's a net add to a benefits plan. This is something new. Yes, there's good rationale for there to be an ROI from it, but we're putting something new in a plan that at least upfront seems to be a cost. There's a number of other areas where, yes, and I know there's people looking at the list right now and shaking their head. There's a number of other areas where virtual care, thinking of that, the remote interactive element of it. There's a number of areas where we're seeing providers coming onto the market. Again, more so in the United States and other places than necessarily in Canada. We're seeing virtual mental health in Canada through a couple different sources, fitness, diet, and the last two, yes, especially when you start crossing over into thinking about not a pure virtual model, but a model that combines in-person and virtual care. Physiotherapy, I think, is one you're going to hear more about in the very near future. The idea of being able to interact with a physiotherapist, have them monitor your exercises remotely. Teledentistry, there was actually an article in CBC about teledentistry only a few weeks ago. So yes, these things are all happening, and like I say, they're happening more so in other parts of the world. But these are all things that we, in one shape or form, cover within our benefit plans today. So these are the kinds of things that actually present the biggest potential of replacing a costly in-person visit with a less expensive virtual visit. So beyond just the cost savings, again, just when you think about now doing things virtually, what are some of the things you can do different? You can have asynchronous communication, emailing or texting with a provider. You can have micro visits. Why do you need to have a 30-minute visit if you have a 30-second question to ask a provider? You can schedule a 5-minute visit for a fraction of the cost when you can do that virtually. No one's going to schedule a 5-minute in-person appointment. Preventive assessments, so dental checkups, but if you've actually got easy access to virtual physiotherapy or virtual mental health, who's to say you can't use those facilities to easily do annual mental health checkups or annual physical health checkups, or the same way that you would do an annual dental checkup. So there's a lot of different possibilities here that are coming down the pipe, and again, good for advisors to be aware of them. Obviously, this is not the easiest thing to figure out. Well, how do we incorporate that into a benefits plan? We're seeing the insurance companies starting to ask themselves these questions, but still being challenged to really figure out things like, is this even an eligible expense? How do we adjudicate it? And the real bottom line here is, does it add or reduce costs? I believe that some of these services, if implemented properly, are actually cost reduction strategies. They're a great way of incorporating with employers technology and cost reduction at the same time. The general insurance company attitude, though, I have no doubt, and I've said this at conferences, in 5 years we're going to see this in place. Not necessarily anyone to date that's really leapt to the lead on this, but I think we're going to be seeing a lot of development in the fairly near future from the insurance industry. So, going to ask another quick question here. We talked about telemedicine from the perspective of how familiar is the group. As we now move from telemedicine into the broader virtual care, just curious to see if we've got any or some familiarity within the folks on the line, and as might have expected, a little bit less familiarity with this side of things than we saw with the telemedicine. And I apologize if I cut some people off. I want to make sure I leave time for questions. So just sharing that result. not surprised that there's not as many people that are in the very familiar category. I'm not surprised at all that some of these ideas are a little bit outlandish when you first hear them, but glad to see that you got 70-75% that have heard the concept. I think these are the ones that in some ways are going to be really interesting, because when you look at the absence of technology in the way health and benefits is delivered today, and the desire from an employer perspective to look at ways to control costs, I think you are going to see some of these become important elements in the future of being able to do that leverage of technology and reduce costs at the same time. So I'm going to quickly go through to, just two more quick questions here, and then Mike will open it up for questions from the audience in about a minute or so. When you look at, so from the context of the telemedicine specifically, where do you see this being within benefit plans 5 years hence? I mean, we talked about, we talked about the percentage of your clients that you're seeing now and whether you're recommending it now. But when you look at telemedicine and say, 5 years from now, where is this going to have evolved to? Sometimes it's easier to look out 5 years than it is to look out a year or two. In general, the answers are falling into one of two categories. It's either going to be paid for by the government, or it's going to be a core part of most benefit plans. Interesting to see that really it is one way or the other from the perspective of the people in the audience today. And then the last question before we move on to the Q&A. Same question as a second ago. The question was on the telemedicine side. Now the question on the virtual care side. Yes, some of these are much newer ideas. There are a handful of providers out there in Canada, but we're not inundated with providers like we are on the telemedicine side. But curious as to your thought based on that small tidbit of knowledge. Where is this going to be 5 years from now? And actually, I'm going to leave it up for just another second or two, and then Mike will pass it over to you for questions. But happy to see, and I will share here. Nobody thinks this is going to be a forgotten fad, which is great. We do have some skeptics thinking that we're still going to be waiting for the insurance companies 5 years from now, but the majority are saying that one way or another, this will be connected to benefit plans, whether it's something that, answer number three, where there's a niche service that very few people will use. I'll argue that in some ways that's almost not the most important point. The most important point is that you're giving people a range of ways of accessing care, and they'll find the ones that work best for them. It's not to say that virtual is going to replace in-person care, far from it. I think it's complementary, as I mentioned a minute ago. So with that, I will close that survey. And Mike, I'll pass it over to you for any questions that have come up during the presentation.
Perfect. Thank you, Tim. Lots of great information there. And again, just reminder, folks, you can probably see it, but on your control panel, there's a question thing. Feel free to type in there. All right, first question, and not even one of our planted questions, Tim, legit from one of the advisors.
We had planted questions, Mike? I don't think we did that, did we?
Oh, was that a trade secret? So this is from Mitesh. I think, hopefully I pronounced that right. It says, hi, Tim, from your knowledge, what is the quality of the physicians within these telemedicine provider networks, and why would a Canadian physician use their time to provide virtual care when they can make more money, boy, that was a loaded question, in a face-to-face under the public system notionally? Your thoughts?
Yeah, no, it's a great question. And, one thing I will say is that, for a physician to be, on and working with one of these platforms, obviously all of the same standards of care that they would have in person need to translate through into what they're doing virtually. So in terms of, quality of care, I think you're going to get as good a care through a virtual platform as you will in person, provided the service being offered and the question being offered is something that can effectively be done virtually. And so you will see a lot of these platforms will screen out certain kinds of questions and say, go see a physician, go to an emergency room, go to a clinic. They're generally pretty good at making sure that questions that aren't appropriate for this setting aren't asked in this setting. The question about why physicians might be interested, there are lots of examples of whether it's I've got a family member who is a dermatologist who may be interested in doing a few extra consults outside of her normal office hours when her kids are busy in activities on a Saturday afternoon. It could be an emergency room physician who's got a gap between shifts, who's looking to earn a few extra dollars. There are physicians out there who have gaps in their schedules and who have an interest in being able to continue to see patients. It is also something that the service does the scheduling for them, so they don't have to have an office and a secretary and somebody booking the appointments. The appointments kind of get booked for them, and they just essentially do what they do best, which is being the most educated healthcare practitioners in our country, without having to do all the administrivia. So there's a few different reasons. It's obviously not for every physician, the same way it's not for every patient. But I think you've got enough physicians that are interested in trying to expand the care they offer in one way or another.
Yep, great. Okay. Mitesh says, thank you. So two people, Ted and Chad, both asked a question that has some parallel around sort of the AI area, and just sort of, you'd mentioned it as noted in one of the slides. How is it, to the best of your knowledge, being used today? Where do you see it fitting in the future? And just as a sidebar, for any of you who are big podcast listeners, I came across something, you can check this on your time. There's a great podcast now called Should This Exist? If you Google that as a podcast, but they had one of these on there, and it brings forward some interesting ethical questions too. I think it's more US based, but there's an app called WOBot, so WOE bot, and it's a cognitive behavior therapy driven app that's purely AI. And I played around with it, and it said there's no hope for me, but that's beside the point. But it's interesting in terms of how the technology is evolving. Your comments?
Yeah, so I think most of what you're seeing right now is using the AI for something like the triage of finding out a bit of information about what your condition is, what you're looking for today, to make sure that the service can actually help you before passing you on to a real person. So the AI, I'm sure that if there's any of the providers on the phone, there's a lot of different ways that these companies are looking at either using AI currently or expanding their use of it. The triage side is one, and so it's complementary, if you will, to the practitioner. In certain examples, in other places, there is a teledermatology website in the U.S. That basically you take a picture of what's going on with your skin, you send it into the website, and not in real time, but they'll actually send you back commentary. The one site, at least, that I was looking at, they actually use AI to do the initial review. By looking at the picture, the AI essentially provides almost a initial recommendation, but then goes through a physician before coming back to you. So we're seeing AI in a few different places in healthcare in general. We're seeing it in areas like radiology, where reading X-rays and CT scans is an area they're talking about. AI and machine learning can be applied. Right now, I'm not aware of anybody who's replacing physicians with machine learning or AI. They're really complementing and helping to steer and triage and maybe perhaps even give hints or nudges to physicians rather than trying to do their job directly. So in the ideal world, you actually minimize physician time, not replace it.
Interesting. Yep. Good. Maureen's got, it's kind of the $1 million question, and I'll add a little color to this. So her question is, any recommendations, and I think you alluded this in some of your presentation, but on how to best evaluate the different providers. The coloring piece that I would add, if it's relevant, is do you feel that beyond their value proposition, like what their services provide, is the background stuff important, especially at these early stage, like funding, who owns them, that kind of stuff? Anyways, comments there?
Yeah. Yeah. So, like I say, I think the first thing to do is try to narrow down what your client's looking for. I mean that is whether you're talking about helping them select an insurance company or otherwise, you need to be making sure you do have different business models out there. Which one is the one that fits best for your particular client? The partnership can make a difference. Understand what that partnership means. If they're partnered with an insurance carrier. The funding is an interesting one, because when you talk about there's a few pieces to that. With 11 or a dozen providers out there today, will there be a dozen providers 5 years from now? It's possible that you'll see consolidation within this industry. Possibly you'll see fewer players down the road. Knowing where an organization, or how well funded an organization is, even just in the context of how long have they been in business, and are they likely to still be in business a year from now or 2 years from now? I think most of those names I threw up there are likely to be in business a year or two from now. But it is important to know just how solid is this organization? How financially viable are they? That's information that they can share with you in an RFP process or whatever. But much like it used to be more of an issue way back when you actually looked at credit ratings for insurance companies to help an employer select an insurance company. It's important to know who the organization is and make sure you have a sense of their stability, the length of time they're going to be in. They've been in business, and what their future looks like, what their future roadmap and what their future plans look like. And at the end of the day, it often comes down to make sure you talk to some of their clients. There needs to be enough references out there to say, yes, this is an organization who's delivering good results for other clients already.
Great. So we're going to wrap up the questions there. We actually have a bunch more, which is fantastic. And no word of a lie, did not use any of the planted questions. So for those of you who put in other ones that we didn't have a chance to answer, we've got them recorded, and we're going to, we'll circle Tim in after this to see if he has comments, then we'll get back to you offline, and we'll let you know. So Tim, you got a few wrap-up comments and then a few reminders, and then
just basically one, and knowing we're getting close to time, just one quick slide to wrap it up. Again, I've always taken the view of not, even if not every client absolutely should be implementing telemedicine tomorrow, it is far enough along that it's your responsibility to make sure that they're aware of what's happening. This is an area that's changing quickly. They'll have heard something. They need to understand. They need to know how do we make a decision? How do we navigate through this? And this is both the joy and the pain of this business right now. Is sometimes there's no roadmap. This is kind of why experienced advisors with good judgment, who understand their clients and understand their business needs, understand their benefit plans, are more important than ever to help clients make difficult decisions about a topic they're really not very familiar with. And I throw that cartoon on there just as a closing statement. Basically, if you're not talking to your clients about telemedicine, probably somebody else is. So you don't want to be the individual who didn't bring it up with them. It just is part of good ongoing client relationships to make sure that you're the one that's informing them and bringing this to their attention and helping them make the decision, whatever that decision might be.
Fantastic.
So with that, I think we're good.
Says it all. Thank you. Yeah. So just thanks to everybody who attended today. This was one of our best attended webinars, and certainly a lot of interaction through the questions. So appreciate that. Just a reminder that we will be sending out an email shortly after this webinar to get your feedback. We'll also be applying for the CE credit. So there's a process many of you know, for us to do that, but under the assumption that we get approved in all the jurisdictions, you'll be receiving the CE. And last but not least, I really want to thank Tim for joining us today and sharing his insights on telemedicine. And to everybody else, enjoy the rest of your day. Thanks, Tim.
Great. Mike, thanks for having me. Appreciate that.
All the best.